I am Dr. SwatiKumari Pandey. I'm an obstetrician, gynecologist, and fertility specialist. And this video today is about ovum pickup procedure. This procedure is done in two instances. If you want to do fertility preservation or if you're undergoing an IVF cycle. An IVF cycle involves ovum pickup, fertilization, and implanting the embryo back into the uterus. So the ovum pickup procedure is usually considered the most invasive one, and it's what everyone's most anxious about. So hopefully my video today will make you a little bit less anxious and give you more knowledge about what's going to happen during this procedure. Now, this procedure is done under anesthesia, general anesthesia usually, inside the operating theater. You have to be on an empty stomach and not even take fluids. And when you come in for the procedure, you have to sign a consent form. In the consent form, they explain some of the risks. The major risks involved may be that you get a slight chance of hemoperitoneum or bladder and bowel injury, but trust me, it's a relatively safe procedure. In all my years of working, I've seen very little complications come along. And inside the operating theater, these follicles inside your ovaries are aspirated and eggs are collected, and either they're preserved in liquid nitrogen or fertilized to form an embryo. Now the second segment of this video will show the actual procedure. The ovum pickup procedure is done under general intravenous anesthesia. The ovary and the follicles are brought into focus after inserting a vaginal ultrasound probe. As can be seen here, these black structures containing fluid are follicles. A thin, long needle is inserted through the vaginal fornix into the follicle under ultrasound guidance, and the follicular fluid is gradually aspirated. It can be seen in the above video that the size of the follicle is gradually decreasing as the follicular fluid is being aspirated from that particular follicle. We wait until the whole of the follicle collapses at the tip of the needle, and then we target another follicle. As can be seen here, once that follicle is finished, another follicle is targeted and needle is gradually inserted inside. Around 80% of the follicles contain eggs. So this segment of the video shows follicular fluid being aspirated into test tubes. Once the test tube gets full of follicular fluid, it is then changed. The tubes are connected to another tube, and the test tube is then handed over and taken to the laboratory. In the laboratory, the follicular fluid is examined under a microscope, as can be seen over here, and a search for egg is done. Eggs are then identified and separated. Thank you.